This PowerPoint contains few question and answer about the maternal and neonatal nursing. It includes antepartum question answer, intrapartum, postpartum, and neonate. The first question here, which action should a nurse perform immediately following the birth of a newborn? Number one, aspirating mucus from neonate's nose and mouth, drying the neonate to stabilize the neonate temperature. Number three, promoting parental bonding. And number four, identify the neonate. So out of four, which is the most important? Immediate following the birth of neonate. The correct answer is keep dry the baby, or right, dry neonate to stabilize the neonatal temperature. This is the first priorities. Then you can go to identification or promoting the parental bonding. The rationale said the nurse's first action after the birth is to dry the neonate and stabilize his temperature. Aspiration of neonate's nose and mouth occur at the time of delivery. Promoting parental bonding and identification of the neonate are appropriate after the neonate has been kept dry. So they said here the early sign, early skin-to-skin contact between mother and neonate is very important. But it is after make them dry and stabilize the neonatal temperature. Also, the advantage skin-to-skin contact or keep them drying, it prevents hypothermia, prevent infection, and prevent hypoglycemia. Next question. A nurse is providing care for a postpartum client. Which condition increase this client risks for postpartum hemorrhage? Number one, hypertension, uterine infection. Number three, placenta previa. And number four, severe pain. So out of four, which is the answer? The correct answer say placenta previa. So severe pain does not lead to postpartum hemorrhage. Infection leads to the septicemia, not hemorrhage. So rationale said the client with placenta previa is at the highest risk for postpartum hemorrhage. In placenta previa, the lower uterine segment does not contact as well. Right, as well the fundal part of the uterus. Therefore, more bleeding occurs. Hypertension, severe pain, or uterine infection do not increase the client risk for postpartum hemorrhage. In this picture, we can see this is a normal placenta, you see here. And this three is placenta previa. Three types. Low implantation placenta close to the birth canal. This is called partial placenta previa. And this one, total placenta previa. Next picture, we can see this is a normal placenta. And this one is abruptio placentae. So it is the placenta, blood is accumulated here. And this is the placenta previa, where placenta previa close to the birth canal. So placenta previa partial or complete, covering the cervical os, you see, by the placenta. In case of placenta previa, it is painless vaginal bleeding, and blood is bright red, or we call bright red bleeding, may or may not be visible. It is common in older mother, or it is common in multiparity. So if mother have placenta previa, it is very important not to do vaginal examination. In case of placenta abruptio, it is premature separation of the placenta from uterine wall. It is very painful, dark red vaginal bleeding, and the risk factor, patient chance to develop pregnancy-induced hypertension or pregnancy-induced hypertension, chance to develop placenta abruptio, multiparity, trauma, or cocaine abuse. So client will need a pregnancy or emergency C section. Cesarean section is important for this. What next? A nurse is obtaining a medication history of a client or from a client who suspect he is pregnant. At which week of gestation does placenta transport of substance to and from the fetals begin? First week, second week, fifth weeks, or 8 weeks? The correct answer is 5 weeks of gestation. Rationale said the placenta transport of substance to and from the utera fetus began at the 5th week of gestation. Next question. When performing a physical assessment on a postpartum neonat, the nurse expects to find: number 1, absence the placenta crease, abundant subcutaneous fat or abundant lengo, also patchy fine hair distribution. Correct answer said abundant subcutaneous fat. So when you read this question, it is important to find out the key point. It is postpartum neonat, not the prepartum. So rationale said typical assessment findings for a postpartum neonat include abundant subcutaneous fat, long or silky hair, absence the vernix caseosa, dry, cracked skin, or long nails. Absence the placenta crease or patchy fine hair distribution are typically assessment findings for a preterm neonat, but question asks for the postpartum neonat, right? So before 37 or after 40 or 42 weeks of delivery. Next question, a Gravida 5 para-2 client delivered a 3,000 grams neonat at 38 weeks of gestation. During the assessment, the nurse noted that the neonate is hyperactive, right? And has a hyperactive rotating reflex combined with inconsolable crying. And she also note the intrauterine retardation and suspect the facial characteristics such as short uh, palpable fissure or flattened mid faces, short upturning nose, also thin upper lip, and also smooth the term. Based on these findings, what information should the nurse include in the mother's discharge plan? So when you read this question, a picture came in your mind, and that picture about the fetal alcoholic syndrome or drug addiction babies. So mother who is addicted to alcohol, they deliver a baby, and this baby, unfortunate baby, born with the fetal alcoholic syndrome. And typical characteristics are, you see, hyperactive, hyperactive rotating reflex, and poor weight gain, sneezing. So this is a common sign. Facial character. Number one, refer to an alcohol treatment counselor. Number two, client education or isotretinoin. This is the retinoin A for knee. Number three, instruction on dietary source of folic acid. Number four, referral to the cocaine treatment counselor. If folic acid deficiency mother give a birth, neural tube defect, not like this. So the correct answer said, number one, referral to an alcohol treatment counselor, because this baby born fetal alcoholic syndrome. Rational said, the neonate is displaying sign of fetal alcohol syndrome, which occurred as a result of fetal alcohol exposure. So mother is alcoholic and baby indirectly intake of alcohol. The nurse should include referral to an alcohol treatment counselor as part of the mother's discharge plan. Teratogenic effect of isotretinoin include microtia or central nervous system deficit, cleft lips or cleft palate, mental retardation, then microophthalmia, also dysmorphic craniofacial features. Folic acid is recommended during the pregnancy to prevent neural tube defect. Teratogenic effect of cocaine used during pregnancy include growth retardation, microcephaly, cerebral infarction, or congenital malformation of the limbs, heart, or genitourinary tract and face. What next? Discharge planning is being finalized for a neonate who was born at 32 weeks gestation and was diagnosed with retinopathy of prematurities. What should the nurse tell the parents? Number one, an ophthalmologist will examine the baby before discharge. Number two, you should schedule an appointment with a optometrist when the baby is 6 months old. Number three, before your child entered the public school system, you must arrange for an individualized educational plan with school nurse. Number 4, contact the local support group for the blind. So correct answer said. Number 1, an ophthalmologist will examine the baby before discharge. Why? What are the rationale? So an ophthalmologist commonly examines neonates with retinopathy of prematurities before discharge. Serial eye examination are then necessary to determine the extent of damage. An ophthalmo or an optometrist cannot provide follow-up treatment for neonates with retinopathy of prematurities because some neonates require cryotherapy and laser photocoagulation therapy, both of which must be performed by an ophthalmologist. The parents should contact the early intervention program to set up an individualized education plan for their child before he reached school age. Because the neonate may have permanent vision loss, intervention before school age is important to the child growth and development. The school nurse is only involved with individualized educational plan for child of school age. Neonate may not be blind. So suggesting a support group for the blind is not appropriate. Next, the nurse is caring for a client on her second postpartum day, and the nurse should expect the client lochia be red and moderate. Number 2, continued red clot. Number 3, brown and scanty. And number 4, thin and white. Correct answer is red and moderate. So rational said during the first 3 days, the lochia will be red and it is called lochia rubra with a moderate flow. Also, it is important to note, however, that the client should not be soaked more than 1 pad every hour. Right? Keep this note. Lochia rubra, the first stage. Lochia is a dark red. And some would say this lochia should be bloody or bright red. It is 1 to 4 days long. And rubra, no odor or slightly fishy odor. 4 to 8 pairs per day is normal for lochia rubra. What next? A continuous flow of moderate clotting blood from vagina is not normal and should be reported to healthcare provider. Clot may indicate retained pieces of placenta inside uterus. Also, lochia changes to pink or brown. It is lochia serosa after 3 to 10 days. So lochia serosa, it is second stage. Lochia is pinkish in color. It is basically around 10 days, or I said pink in color or pinkish brown. It is serous. 5 to 7 days postpartum. no order. And lochia alba, it is creamy yellow, maybe brownish, 1 or 3 weeks postpartum. If it is also no order or body odor. So they said that by the day 10, the lochia should be white. We call lochia alba to continue the 7 weeks. Next question. A primigravida client is admitted to the labor and delivery area where the nurse is evaluate her, which assessment findings may indicate need for cesarean section of baby or birth. Number 1, insufficient perinatal stretching, rapid progressive labor, umbilical cord prolapse, and fetal prematurities. So in what condition we can arrange for cesarean section, right? So correct answer is umbilical cord prolapse. What is umbilical cord prolapse? Umbilical cord prolapse occur when the umbilical cord drops through the cervix into the vagina, and right? So you see the picture, this is the umbilical cord came out, we call prolapse or prolapse cord. So if anything is happen like this, never try to put this cord back inside, very important. And also with sterile gloves or left the presenting part of the cord or place the mom in tendal bar or knee chest position, very important. So rational said indication of cesarean birth include umbilical cord prolapse or beach presentation or buttock presentation, unsuccessful labor induction, insufficient perinatal stretching, rapid progressive labor, or fetal prematurity are not indication for cesarean birth. Here we can see a definition of umbilical cord prolapse. The umbilical cord prolapse or prolapse cord through the open cervix into the vagina, also ahead of the baby, where it may lie adjacent to the presenting part or below the presenting part. Any. Next question here. A newly hired nurse and on unit orientation prepared to admit vitamin K to a unit. The nurse draws up 1 milligram of vitamin K and prepared to admit a subcutaneous injection in the left lateral anterior thigh. Which action by the nurse receptor is the best? Number 1, we encouraging nurse for correctly prepare to admit the injection. Number 2, stop the nurse and have her re-evaluate her injection techniques. Number 3, distract the neonate by talking to her in a calm voice. Number 4, stop the nurse and instruct her to admit the vitamin K using zigzag method. Correct answer is number 2. Stop the nurse and have her re-evaluate her injection techniques. Why? Rational say the vitamin K should be administered by intramuscular injection, right? And therefore the nurse preceptor should stop the nurse and have her re-evaluate her injection techniques. The nurse preceptor can raise the nurse after injection is administered correctly. The nurse preceptor can distract neonate by talking calmly to her, but she should first stop the nurse from administering medication by the wrong route. The injection should be administered by intramuscular route, not by the method. Next question here. A client who has been in the later stage of first stage of labor and also is transitioning to the active phase. During the transition, the nurse expects to see which client behavior. Number one, a desire for personal contact and touch. Number two, a full response to teaching. Number three, fatigue, a desire for touch and wetness. Number four, withdrawal, irritabilities, and resist to touch. So this question about the latent phase of the first stage of labor. So the labor has three stages: early, late, and variable. So what are the correct answer? Withdrawal, irritabilities, and resistance to touch. Rational said during the transition to an active phase of the first stage of labor, in case the pain typically makes the client withdraw, irritable, and resist touch. During the latent phase, which one is latent phase? The early part of the first stage of labor, when contact are not intensely painful, the client typically desire personal contact and touch and response to teaching and intervention. Also, fatigue, a desire for touch and quietness are common during the third and fourth stage of labor. Here we learn few question and answer that will help you in your NCLEX licensing board exam. I always like to request you to practice this question and answer and get your license.